Well, are you keeping your partner or your spouse awake at night with your snoring? Besides being highly annoying, your snoring can actually be a sign of a serious health issue.
That's right. Dr. Kalpana DePasquale is the founder of St. Augustine Ear, Nose, and Throat, and she brought along one of her patients, Craig Soublier. Dr. DePasquale, we'll start with you. Thank you both for being here, first of all.
Thank you.
I can relate to this problem because, as I was telling you, my husband sounds a lot like, our guest here, snores really loud, but this is Men's Health Month. Tell us a little bit about why men need to be aware of these sleep issues.
12 million men in the United States actually suffer from either obstructive sleep apnea or health-related issues secondary to sleep apnea. So because this is Men's Health Month, I think this is a great time to encourage men to, if they think they have sleep apnea, if they're snoring, if they're not getting a good night's rest, to at least seek medical attention so that we can identify the problem and move towards a treatment plan.
And so what do you specialize in when it comes to men and snoring with these issues?
Well, I think one of the big things that's different about men is sometimes they're often a little bit reluctant to share their concerns. Sometimes they're a little more, they don't want to go to the doctor as much. So men are a little different than women in that respect. Not all, but some are like that. So I think it's important to make them feel comfortable so that they feel comfortable discussing their issues and what's at hand. Then after that, we get a good history, a good physical. Then we can do some diagnostic tests to see whether the patient has sleep apnea or not.
Now, Craig, let's bring you into the conversation. How did you figure out that you were having sleep issues, and did you notice it all on your own?
Well, I kind of noticed that, I would stop breathing, in the middle of the night, it would wake me up. But my wife really was the one that was telling me, that she was having to wear earplugs at night. And it was really making her nervous because, I'd stop breathing and she'd yell at me to breathe and I'd start breathing on my own. But about probably 3 months ago, I got a pretty big scare where I woke up, ran out of bed basically, and I couldn't catch my breath, so I knew that there was an issue that I had. So I really wanted to kind of fix that. So,
and we actually have video that your wife took of you to prove to you there is a problem and you need to go see a doctor. Here we go.
Breathe. Breathe.
And so she's reminding you, Craig, to breathe.
I'm mortified for your poor wife because it must be so stressful. Here's you taking kind of a nap in a chair.
Breathe.
And she's telling you to breathe again.
At least he's obedient and he does breathe, so that's good.
But I mean, your poor wife hasn't slept in how many years? Because she's either awake from the snoring or listening to you breathe, not breathing and telling you to breathe.
She's professionally with the earplugs now, so she's been sleeping a little bit better with the earplugs, but it's still, I know that she's uncomfortable with worrying about me, breathing.
So we've got a man here. Why won't you go to the doctor? You know you can't breathe when you're sleeping.
Well, for me, at first, I thought it was a weight issue. I gained some weight, a significant amount of weight, and my sleeping was really bad, and then I lost 30 pounds. I felt a little bit better, but as you see in the video, that was taken a couple weeks ago. I still have problem breathing on my own in certain positions. So, and I think too, myself, I'm a little bit stubborn and I didn't really want to go to the doctor. And then I thought, I don't have insurance with my work, so it's going to be costly. And then, I was just been putting it off basically. But I know that it's a serious problem. I know that it affects my health and stuff. And that's why, I'm here with the doctor today to, get this problem looked after, because it's not as expensive as I thought it was going to be. And, and it's really worth, your health.
Breathing.
Sure.
Yeah, breathing.
Yeah,
Right.
for sure.
Now, Craig is the poster child, really, because, I mean, let's give him a little bit of credit. He's not alone. Most men, are they don't want to go to the doctor.
They absolutely are.
And they come up with a cadre of reasons.
Right.
I'm busy, or it's expensive, or I can deal with it on my own.
So what do you do then when they do come in to help diagnose, people who are having sleeping issues like this?
One of the great things is it used to be that you always had to go to a sleep lab. So that is one of the things I think that does prevent people from wanting to come in. But these days we have these great little devices that are home testing devices. There's Accusom and Snap. So people can actually get an accurate diagnosis in the comfort of their own home, and that just makes a lot of difference. From there, once we see if they, number one, have sleep apnea, and if they do, how severe is it, then we can move towards treatment options ranging from maybe minimally invasive like CPAP to surgical if it's severe enough. So there's definitely a lot of different options to entertain.
Plug your ears, Craig. You didn't hear surgery.
Yeah. Explain really quick the CPAP for folks who may not be familiar with that, what that is.
CPAP is continuous positive airway pressure. So what it does is most of the people with CPAP have some sort of obstruction in their body, whether it be in their nose or their soft palate, the back of their tongue. Something is collapsing when they're asleep at night and their muscles rest. So what this does is it provides oxygen to you. So it just blows air. When you stop breathing, it'll give you that puff of air that you need so that your oxygen levels don't go down.
Well, Craig, I will tell you that, and I shared with you a little bit earlier, I went on a trip with my mother and realized she was doing the very same thing, not breathing. So she did the test, she's on the CPAP, and not only is she breathing, but she says her mind's more clear. People have been telling her she looks better, she just looks better rested. So there is a good effort in here, and at the end, you will be glad that you went.
I'm sure there are also a lot of women at home who are ready to take down your
Absolutely.
information.
Absolutely.
Like, that's me, I can relate with his wife. So how do they find you?
We can be found online at sant.net, and also our phone number is 461-6060. We have 2 offices, one at Plantation Island Drive and one in Ponte Vedra near Nocatee and Palencia.
Okay, well, I've got your information. I will be calling you soon. Thank you so much.
And thank
as always,
you for
being
coming
here.
on,
Thank
Craig.
you,
That was
thank
brave
you.
that you came on
Thank
and
you.
let us kind of
Very brave.
Thank you so
Berate
much.
you a little
Yeah, berate you a little bit on behalf of all women. All right, well, we'd like to thank Dr. Pasquale for the advice and for sponsoring this segment. Learn more about St. Augustine Ear, Nose, and Throat online at saent.net. You can also give them a call at 904-461-6060, and you can follow the doctor on Twitter. Her handle is @DRK De Pasquale.